All right, good evening, everyone. I'd like to call to order the September 9th Community Mental Health Program and Budget Committee. And I'd like to start by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, I will seek a motion to adopt the agenda.
So moved.
Motion. Support, Phillips.
Motion from Burke and support from Phillips. Any questions or comments from board members on the agenda? All right, seeing and hearing none, all in favor signify by saying aye.
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 All opposed?
Aye.
The agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak on any item on the agenda, you have 5 minutes. Just give us your name and address. And if you'd like to put your name.
Oh. Sorry.
Dave, you unmuted. You muted all of us.
I am trying to unmute everybody. I'm sorry. That was me. There we go. Ask all to unmute.
Perfect. All right. If you would like to speak, it would probably be easiest if you can to put your name in the chat box. If not, just try to speak up. We do have a few in the chat box to start, and then we will go from there. Again, you have 5 minutes. Please give us your name and address. And we will start with Tim Greimel.
Well, thank you very much, Phil and Chairwoman and members of the board. I really appreciate the opportunity to speak to all of you this evening. My name is Tim Greimel. I'm the Legislative Director for AFSCME, the American Federation of State, County, and Municipal Employees, Council 25, which is the statewide council here in Michigan. And I wanted to speak on behalf of President Larry Rohrig, who's the president of the statewide council. He specifically reached out to me today and asked me to speak on his behalf. As you can imagine, he and all of us at AFSCME are very concerned primarily about a lot of the unanswered questions about what transition to an authority would mean. We obviously will never go along with anything that we believe jeopardizes the well-being of AFSCME's membership, and we will certainly fight tooth and nail against anything that we believe will do any harm to our members. And we are very concerned about some of the unanswered questions here. We know these questions have come up through the process of the task force, questions about exactly what will happen with retirement plans for AFSCME members, exactly what will happen with healthcare for AFSCME members. We were, on the one hand, encouraged by your email, Mr. Pankatai, that certainly confirms some of the protections in state law for the collective bargaining agreement, that employees can't be any worse off for at least a year after the transfer, and that employees will still be considered public employees and subject to para under state law. So we certainly appreciate that recognition and that understanding. But, and we also appreciated some of the suggestions and implications of your email about trying to look after employees' pensions and healthcare. But there certainly is not, as of now, any real concrete clarity around what that will look like. And we believe it's important, before we move forward with any kind of proposal like this, that there be more clarity about exactly what the plan will be in terms of pensions and other retiree benefits, as well as healthcare for active employees. So we would simply ask that we have an opportunity to sit down with you, have that conversation with our staff representative, with the new leadership at our local, and make sure that we're trying to address and answer all of those questions, so that ideally we can work together to address this in a way that actually addresses the concerns and needs of everybody by answering all of those unanswered questions. So very respectfully, I'd ask that you not vote this evening to approve this recommendation, but rather take a step back and work together with AFSCME and the members that we represent in order to try to make sure that whatever is done is a win-win situation. Thank you so much for the opportunity to speak with all of you tonight. I really appreciate all of your service to the cause of promoting mental health in Macomb County. It's extremely important, and I appreciate your service.
Thank you, Tim. I just want to remind everybody too that we just are listening at this point, and then staff will get back to you if there are specific questions or comments that need to be responded to. Thank you again, Tim. Next is Stephanie Nahas. I hope I'm saying your last name right, but please give us your address. You have 5 minutes.
Hi, you are saying it correct. My name is Stephanie Nahas. I am that staff representative from AFSCME that Jim referred to you earlier. First of all, I want the board to know that the union does stand in opposition for CMH to become an authority. This is a very undemocratic move, we feel, leaving no accountability to the citizens and the consumers. My first question to all of you is, has the CMH board done any actuarially evaluations of all the costs involved? Is the board aware of other counties that have gone to an authority? We have heard that some have failed and that some have filed for bankruptcies or have received bailouts from the state, leaving consumers in a lurch for services and employees left in the cold. I know in Wayne County, employees are still feeling the ill effects of the authority. Some authorities have privatized services. So the question would be, is this the intent of the CMH board, is to privatize services eventually? Are you all aware of that after 1 year, all services can be bid out, privatizing services, forcing a change in services to the consumers and leaving employees to face unemployment or forced to bid on lower paying jobs? What is the cost of health care for employees, union and non-union? Mr. Pankatai claims that they think they can get comparable health care coverage. I believe that we need to know for sure what those increases in health care to all county employees will be and what the cost will be to the employees once the CMH employees will no longer be there. There will certainly be an increase. And what is that increase? To the pension plan, conversion will be extremely costly. That number running well into the millions. This was certainly a deterrent for Washtenaw County not going to an authority. This will also cause depletion of the county's current pension structure. Again, the BOC needs hard numbers on this and how it will directly affect all county employees before moving forward. Let's not forget about the vulnerable consumers that CMH assists, the most important factor in this decision. Mr. Pankatai claims that the authority will have no effect on the consumers. That is not proven to be true. Services will become erratic. Consumers get lost in the shuffle. When there are concerns, the consumer is left to help on their own, find help on their own. After the initial year, services can be bid out and awarded to companies that lowball services, which these services are privatized. These services lack the quality of service to the consumer and jeopardizes our jobs. There is no coordination of services due to the multiple use of agencies. The consumer loses, as does the employee. It was stated that positions will become direct hires of the authority up to and including human resources, causing massive layoffs of the county employees. There can be no smooth transition of this policy. It will cause disruption to the consumers and all county employees. Again, it's been stated that you are important to the future of Macomb community health systems. Nothing right now could be further from the truth. The consumers and the citizens of this great county should not be pawns in the game of a business. I leave you with these questions. Will you request, or will the BOC be given an actuarial report for the budget? What will the cost increase of healthcare be to CMH and to county employees? Will healthcare coverage be protected and for how long? What will the cost be in implementing a separate HR department? What repercussions will there be to the county as a result of a separate HR department? Will employees' pensions be protected? Will employees' pension plans be protected fully and be continued after the state mandated timelines? Will salaries be protected or reduced after the state timelines have passed? Will healthcare coverage be maintained after the state mandated timelines? Will the authority maintain all current employees at their current rate of pay even after state mandated timelines? Will the authority continue to bargain in good faith and recognize a successful contract? What will the cost to the authority be to reimburse the county?
Stephanie, you have 30 seconds.
Okie doke, I'm almost done. The union encourages the board to vote no at this time until all these questions have been answered. Leave no stone uncovered. We'll be very much interested in negotiating with CMH on this prospect, depending on how you go forward. So I want to thank you for your time. I will leave my address for you in the chat line. Thank you.
Thank you, Stephanie. Perfect timing, right at the 5-minute mark.
I timed myself.
All right, next is Carolyn Gamichia. I know you've talked to us a few times. I hope I said your last name right. Carolyn?
Hi, yes you did, and thank you very much. I'll be short and sweet here. This is the third time that I've come before this board to request information regarding premium pay for direct support professionals in Macomb County. I initially asked to be advised which professionals providing both community living supports and or respite were being paid premium pay that Mr. Pankatai had indicated was being paid in the June meeting of the board. That's my first area of concern. And I still haven't gotten an answer to that question other than that Macomb County is in compliance with what their PHIP contract is. That's not the question that I asked. I also do want the board to know and the public to know that as of today's date, which is September 8th, that premium pay has not been received from the time period of the memo, which was dated in May, which was a directive to provide those services to individuals within Macomb County for CLS and respite. That back pay has still not been received as of today's date. The second thing that I would like to address is you approved appropriations at the last meeting that I attended for close to $500,000 for assistive technology access and a contract for assistance to provide updated software for employees within Macomb County CMH that had been, it was for replacements, and it was also to assist, I think, with COVID, utilizing care funds. At this point, I would like to request that some of those funds please be provided to individuals that are receiving services through Macomb County via PHIP and Medicaid services through the PHIP contract and Medicaid services that are not in possession of adequate assistive technology to address receiving telemedicine at this point, still during COVID. That has not been looked at. There's something that's something that we have requested in the past, not only for our son, but other people. We have filed in-state hearings regarding our son to get a replacement iPad. It's been almost a year since we've been in hearing for this. And
no, Matt, we just want to listen to this.
Was denied the chance to actually put in for a replacement iPad by your corporate compliance person, whose name is Stacy Coleman. We went to state hearing. The judge determined that he should have been allowed to be able to put in that request during COVID, and she denied that right. She currently is handling the local appeal on this. She did not conduct a local appeal within due process. She did not answer the local appeal in a summary within the 30-day timeline period. Our son is still without telemedicine due to the fact that Macomb County CMH
listening
contract to provide our son assistive technology. So I'm doing this in a public forum because we have also requested of Mr. Panikai to replace Ms. Coleman, who has harassed us repeatedly via text messages, emails, phone conversations, and acted unprofessionally and provided false documentation within subpoena requests and also documents and hearing summaries to the state administrative hearings office. At this point, we have not filed criminal complaints or civil action, but I'm advising you of this information now because it's imperative that you know that this is taking place as a board, that your person who's in corporate compliance and privacy rights has violated our son's HIPAA. We have written proof from a provider that she did so, has violated our son's privacy rights, and it has violated his rights and other people's in Macomb County and other counties in the state where she's been involved in civil litigation regarding harassment. And I really did not want to do this in a public forum because I did not want to embarrass anyone, but it has affected our family and our son in an adverse way to deny him access to not only telemedicine, but to due process and appropriate services under the PHIP contract in this county.
Carolyn, your 5 minutes are up.
Thank you very much.
Thank you, Carolyn.
And I do expect answers to this inquiry and what we've stated, because the harassment policy for the county of Macomb indicates that people are not supposed to be harassed by employees of the county.
Thank you,
and
Carolyn.
It continues. We got an email today with false information from the same person.
Okay, thank you, Carolyn. We will take a look. Thank you very much. Next on the list is Jennifer Jazwiak. I hope I said that right. I'm getting all sorts of last names tonight.
Yeah, you did good. Can you hear me?
I can. You have 5 minutes. Please give us your name and address starting now.
My name is Jennifer Jazwiak. I live at 10071 Carroll Road, Columbus, 48063. I'm a 28-year employee and an AFSCME union steward for CMH. I also served on the authority task force as one of 2 union employee stakeholders. And I would like to address the board regarding agenda item 5H, recommendation for mental health authority. Under authority status, I understand the people we serve, as well as our provider panel, will see no negative impact. However, the employees are the ones that will be impacted the most. I appreciate Dave sending out an all-staff email addressing the next steps, and I hope that transparency continues. There are many unknowns with regards to employee benefits, such as pensions, retirement, healthcare, and future employment. What exactly will happen to our pensions? Will it be frozen? Will it change? Will there be a retirement option? What about the drops? Will drop participants be grandfathered in? Will seniority be carried over? Will there be healthcare offered? If so, what will the cost be associated with that? I ask you, the board, will you get the answers and give the assurances to the staff that they so desire? Will we have the answers to all these questions before a final decision is made? And in closing, I would like to say that I hope we can expect due diligence and questions are answered for the betterment of the staff so that there aren't any of those unwanted surprises. I'd like to thank you for your time.
Thank you, Jennifer. All right, next on the list is Bridget Zabawa. Man, I hope I said that one right. You have 5 minutes. Give us your address and go right ahead.
My address is 1239 Bradley, Troy, Michigan. I was going to speak at the end of the meeting, but that's okay. I work for VDPS, and I've been working for that department for 13 years, full-time employee for 12. Prior to that, I worked in Wayne County, and at that time, well, when I was working for Wayne County in 2000, Oakland County had privatized, and we had hired, the agency I was working for, we had hired some of those staff. And then a couple years later, we went to the networks, and David took over ConsumerLink, and I lost my job at the agency because that particular agency didn't get a contract with any of the 6 networks. 3 of them were for the developmentally disabled, 3 were for the MI. And I worked for an agency that provided services to the MI population. I subsequently got hired at an agency that worked with the developmentally disabled. And I worked there for a couple years as a supervisor. But having lost my job at this particular agency when they went to the network system, I lost my union protection. There was an attempt not to pay the individuals their time in the hole, so to speak, and their vacation pay. But at the time I was a union steward. So me and the union president went to the union attorney's office. We had to file an injunction against filing for filing for bankruptcy so that individuals couldn't get paid out. So that was a bit of a scary situation, but did, stop, we were able to get the injunction. After that, I went over to Oakland County. I wasn't at the Wayne County agency very long. It was difficult in the beginning. Every month, the new list of people covered by the network would change. So every month, I'd have to go over a list with my staff, who we could see and who we couldn't see. But I wasn't there long enough to really experience, the significant change that all the agencies were experiencing. In Oakland County, they had already, when I went over there in 2004, the difficulties they had was, it was the accountability. That was brought up by Stephanie Nehas. All the agencies had existed, but they had been contracted. So there wasn't a direct oversight that Macomb Community Mental Health has with the direct services. We have some contracted out agencies, but the direct services, I believe, because I do oppose the authority, because I believe the services provided directly from community mental health are much higher quality. There is more oversight. When I was working in Oakland County Community Mental Health wasn't directly involved in the day-to-day operations. It was just all contracted. And the quality was very poor. To be honest with you, there was some shenanigans going on, when you go through an audit, there would be people, oh, this wasn't done, this wasn't done. Could you sign this? I was asked to sign documents that I did not even create in order to meet compliance when audited. Never went through that at VDPS. VDPS provides top quality service. My coworkers are absolutely wonderful. The supervision is absolutely wonderful. I believe that to go authority, there isn't enough information for me to pass on to my coworkers because they do rely on me. I've been a little bit more involved now with this than previous 6 months, whatever. There's still a lot of what ifs and regarding the pension. Again, contracting out agencies after about a year, are we going to get a cut in pay? Well, I'm living proof that yes, both agencies that I worked for, once they either went authority or went to the networks, yeah, there weren't the pay raises there. There wasn't the step
Bridget, you have about 20 seconds.
Sorry?
You have about 20 seconds.
Okay. I just, wanted to be heard that the staff needs more information before an absolute decision is made. So please give us that chance to be prepared. Thank you.
Thank you, Bridget. Next on the list is Renee Tringali. And Renee gave us her address in the box. So go ahead. Your 5 minutes starts whenever you unmute yourself.
Okay, just took me a second. Sorry about that. My name is Renee Tringali. I work for ACT, which is a portion of CMH. as an employee, we have sat in several meetings being told about what the authority is, going back, giving examples. And in none of these meetings have any of the employees walked out feeling like going to authority status is the way to go. We feel as though we're kind of being left in the dark. The one big thing was going to an authority that CMH will be able to own property. And that was like the big thing, is we can own property. Well, our consumers don't care whether we own property or not. They care about the services that they get. There is no certainty, like the other person said, about the way that the pay is going to be maintained. Are we going to be able to keep our pay? Are we not? Nobody is asking those questions. The thing about when we were hacked, that hacking insurance, the reason why we were able to get the not only the insurance for that, but the health insurance and the benefits, is because we're in a large pool because of the county. So staying with Macomb County is definitely an asset to CMH, and I feel like it's a way that we're not going to lose why we came to work for the county. We didn't come to work for the county because the money was huge, or because it was a place where we were going to get rich. I came to work for the county because I like working with mentally ill patients. We go into their homes. I don't get paid as much as I get at the hospital. We do get, some benefits, but I'm not going to get rich off my job. And I think that at CMH, that's not the reason that we came to do that. The reason that we came to do that is because we love what we do, and we want to do it in the community where we live. And I would hate for us becoming an authority and losing some of the benefits that we do get by being an authority, taken away from us, and therefore some of our really good employees leaving CMH and going to other settings, which is something that a lot of the employees have talked about. So in closing, I just want to say I think that going to an authority is I don't think it's a good idea. For me personally, I don't think it's a good idea for a lot of the programs, and I know a lot of the employees feel the same way, and not everybody wants to talk, but I mean, it's not just about money for people who work at CMH. It's about the services. It's about what we can provide for people, but we do want good compensation. And I would like to stay in Macomb County where I live in order to be able to provide services to the people in my own community. Thank you.
Thank you, Renee. I don't see any other names in the chat box. Is there anybody else on the phone or out there in the meeting that would like to speak? Give you a second to unmute yourself if you're trying.
Yes, I want to speak. Can you hear me?
Yes.
Yeah, I kind of put my name in the beginning and I don't know what happened, but I wanted to speak.
Did I miss?
Donna Conjemi.
Yeah, hi, Donna. How are you?
Hi. Yeah, I put my name in the beginning and I don't know, it never showed up. So can I speak? Can I speak?
I promise.
Yeah. Can I speak now?
Yes, please go ahead, Donna.
Yeah, I wanted to start by thanking the board for the beautiful resolution that was presented to me by Tracy this afternoon at a Zoom meeting with coworkers and friends. So I wanted to start out by thanking you for that wonderful resolution from last month, and I regret that I wasn't able to attend that Zoom meeting. It was greatly appreciated and a wonderful honor. So I wanted to start by thanking you, the board, for that. And Nick Shimatero, his presentation at the Zoom meeting this afternoon was very, very nice. So thank you all so very much. I'm speaking to you today as a member of the public, believe it or not, a CMH retiree and a former member of the Authority Task Force Committee. As most of you know, I recently retired from the county as the president of AFSCME for Local 411. I was an active member of the task force committee and remained on the committee until the last two meetings. I believe there are two essential questions that must be answered before the committee votes either yes or no on this really vital question. First of all, will the Macomb County Retirement Board allow the employees of CMH to continue to make deposits into the retirement system and stay in the system? Will they be allowed to stay in both as a defined benefit and a defined?
I'm sorry, Donna, please unmute yourself. Donna?
Yeah, I'm doing that. Yeah, I don't know how I got muted.
Wrong click on my part,
yeah.
my apologies.
Where did I stop that you didn't hear me?
The employees being able to make the deposits.
Okay. I think that's really an important issue that needs to be resolved before there's a vote on this issue. And the second question is, what will the future of healthcare be for employees in CMH? How much will their costs increase if they're pulled out of the county's healthcare plan? And will their benefits be decreased substantially if they're pulled out? Now, just to let you know, these are not new questions. As those of you that were on the healthcare task on the task force committee know, these are questions that AFSCME has been asking from day one of the formation of the task force committee. These are main questions for employees of CMH. They are the biggest fears of employees of CMH, yet they remain unanswered. The task force committee moved forward to approve an authority status. My question is, why are they still unanswered after all this time? Why hasn't anyone gone to the retirement board and tried to receive an answer? Why hasn't anyone started the process of examining healthcare? And why hasn't anyone begun to answer these important questions for CMH employees to try to give them some semblance of peace of mind that they crave? These are the big issues that the employees of CMH are afraid of. These are the answers that they need to have, because these are the answers that are keeping them awake at night. I mean, if you ask any of the employees that are in this meeting tonight, these are the questions that they are craving to know, because these are the fears that keep them awake. Retirement and healthcare. I mean, that's what they need for their families. I mean, they need to know, what is my retirement and my healthcare? You're talking about a lot of single women that have children. They can't go forward with their life with what if, maybe, it might be. They can't live without the proper retirement and healthcare for their lives. You know, just like the previous speakers spoke about. It's not about money. It's about their benefits. That's why they came to Macomb County, for the benefits. And this is putting their lives in jeopardy. Jennifer is a single mother with 2 children. I don't know about Renee, but we have a lot of women that are working CMH that are single mothers. She just put her finger up, 3 children and a single mother. You know, that's what their lives are. And this authority status is scaring the living crap out of them. And believe me, that's a lot of the membership that are in there. So until these important questions are answered, that's why I strongly objected to going forward with a vote, because my heart breaks for them. It really does, because I don't want to see them in a topsy-turvy of not knowing what's going forward for them. And I thank you for your time, and I really do thank you. It was beautiful, the resolution that was put forward, and I want to tell you that it was really a beautiful thing, and I pray that you give them the assurances that they need going forward in their lives. Thank you.
Thank you, Donna. Good to hear from you again.
Thank you so much. It was nice seeing all of you.
You too. All right, next up is Deborah Robinson, and your address is in the chat, so whenever you're ready and unmute yourself, you have 5 minutes.
Can you hear? Okay,
yep.
Can you hear me now?
Yep, go
All
ahead.
right, thank you for hearing me. I'd also like to thank Donna and the previous speakers. I feel like they've all brought up a lot of the questions that a lot of us might not be as comfortable asking, and they were all very well spoken. To rally back around to Donna's comments, the things that keep me up at night are, number one, retirement and health care. I've been with Macomb County for 18 years. I live in the county, and I actually left the private sector to work for the county just for the security of having a little bit of a retirement pension. That is what keeps me up at night. During the pandemic right now, it's hard on everybody, but to have this looming over our heads, and again, we don't know. I realize it hasn't been voted on yet, but it does keep me up at night for the future of myself and my family. Like I said, I stuck with the county. I could have left. I could have earned a lot more money, but I stayed for the security for, my golden years. So hopefully you'll maybe circle back and try to reassure us or answer some of the questions so we can at least prepare. Thank you for listening to me.
Thank you, Deborah. Next on the list is Andrew Gamicia.
Hello.
How you doing, Andrew? You have 5 minutes. Go ahead.
Okay, I just want to express my concerns in regards to one of your employees and how she's treating our family. And I also want to meet with somebody from this board to discuss this because she's been sending false information to the state for hearing. And we have tried to express our concerns through grievances and through recipient rights and gotten no response. So I am asking that somebody from this board assist us with this so we can try to work this out and have a good working relationship instead of the adversary relationship that we've been given by your corporate compliance person who basically states she is handling only our local dispute resolutions and no one else's. So she's basically brought in just to work on our items. And I'm not sure why we can't have the regular LDR officer handle our local hearings like everyone else does. We have a compliance officer doing that. She's making false statements. She sent false documents to the state. And I just want this addressed before we have to go any further with this beyond the board. Thank you.
Thank you, Andrew. All right, next on the list is Benez Steele. I hope I said that right. Benez, please unmute yourself and you'll have 5 minutes.
Yes, hello. Hello, can everyone hear me?
Yes, go ahead.
I'm Benez Steele. Ask me Local 411 Vice President. And I just want to reiterate what Stephanie Nahas was saying and what Donna Jimmy was saying. We need answers. We here at the local, we stand in opposition to this authoritative status. What is up in the air with the retirement? No one has given us any answers. We've had representatives at the meetings, still no answers. Today is September, no answers. They want to push this through. What's going on with the healthcare? No answers. What are the single parents supposed to do? They're just supposed to place their healthcare options on a whim and a wish. You're not giving anyone any concrete evidence that this is beneficial. So I implore, AFSCME implores, do not let this pass through. Let's hold off. Let's get more answers. Let's get concrete answers. Thank you for listening to me.
Thank you, Benez. All right, next on the list is Danette Thomas. Danette, you have 5 minutes. Please give us your address and unmute yourself.
Okay, I unmuted myself. My name's Danette Thomas. I work for First Southwest CMH. I'm a nurse there. And I just want to say I left the private sector to pursue a career with the county. And what drew me to the county was, of course, the pension and the benefits, never realizing that while I worked there, I became a widow, which was unexpected for me. So, I mean, I think we need to realize that when we're making decisions like this, that it really is affecting each individual person, and we're not just a group of employees, but we're a family. We all work together. We care about our community, and I would hope the people I work for would care about us the way we care about our consumers. We are people with needs also, and I mean, I know I speak for myself, but I'm sure there's other people out there just like me who I am 60 years old. I can't just go work somewhere else and try to build a pension somewhere. I mean, this is the only thing I have that I think later on in life, I won't be in the poorhouse. We can't count on Social Security anymore. So there's a lot of things here. I mean, healthcare, a lot of us are really scared. I mean, we've worked through this pandemic. I know all the nurses, we put our necks on the line for the county. We went out there and worked, even though we were putting ourselves at risk, which I don't mind. That's my job. But I just want to think that the people that are making these decisions care about us and care about our needs as well, and that it's not just all about the money. I hope it's about more than just that. And that's all I would like to say. Thank you.
Thank you, Danette. Sorry for your loss, but thank you for your comments. Next up is Ryan Zalowski. Ryan?
Hello. I am a nurse. I work for CMH. My biggest question is some of our neighboring counties, Oakland County, Wayne County, St. Clair County, have all become authorities. When we've spoken to other people that's, whether they've been employees or administration in those counties, they're not reporting many benefits to them, to their becoming an authority status. I'm wondering if specific examples could be provided from those counties. What were the benefits to becoming an authority status? What specific examples? Why are we considering this? Why are we pursuing this so heavily when there's really not much positive being reflected in the other areas that surround us? So that's pretty much my question, my biggest concern.
Thank you, Ryan. Appreciate your question. I don't see any other folks in the chat box. Check one more time. Is there anybody else for public participation? All right, hearing none, we will close the hearing of the public. There is another one at the end of this. If I missed you, if you couldn't get unmuted, I appreciate everybody's patience and using the chat. This went very smoothly considering how many people we had speaking. And with that, we will move on to item 5A, request to approve a hospital per diem increase. I'll take a motion to approve that for full board.
So moved. Burke.
Support Bush.
Motion from Burke, support from Bush. Dave, did you want to speak to this item?
Yes. So with in speaking with the state, when they removed the system redesign from the table, in its place was the provider stability plans. So every month since June, I have been submitting updated information to the department about what we've done on the provider side during the pandemic. It's an extensive list of actions that we've taken. Working closely with Richard, working closely with the state. We are also now looking at specific groups of providers, how they were impacted. We're looking at adjustments going back primarily from October through March for some of our providers. The hospital providers, however, were in a group by themselves. We were the fiduciary for some HRA payments that came down and through us, through all of the PIHPs and went out to the hospitals. Those stopped at least by the end of this fiscal year. In looking forward and looking at our budget and the current hospital per diems, we felt it was the appropriate time to make these adjustments. So what we're asking for is the a $40 per day increase effective October 1st. We'll reevaluate it mid-year to look at the impact on our bottom line. But every projection we have is that this is manageable and it's a step in the right direction for our hospital partners. When you look at Macomb County and our per diems, we are on, I'll say, to be kind, I'll say we're on the low side, and I'll try not to look at Selena when I say that. Yeah, I looked at Selena, I'm sorry. So this is a step in the right direction. And again, it's part of our provider stability plan. The state was asking for consideration for the hospital partners and to that to be included in the plan as well. So that's the rationale.
Thank you, Dave. Kathy with a question?
Yes, I do. I support this move. Dave, you had said that we will continue evaluating it. Will the providers, the hospital partners, know that it is subject to change? I guess it's always subject to change, but how will that be communicated?
It'll go out with with this meeting. We have a hospital meeting, provider meeting coming up. We can include that correspondence with the contract rate adjustments and everything else. It's possible the adjustment might be up, might be an upwards recommendation, or it might be to maintain it, or it might be, you know, I seriously doubt it would be to go back to where we were. You're muted, Kat. You're still muted, Kat. Okay.
All right, Nick, go ahead.
Yeah, Dave, I think this makes some sense. This is about a 7% increase.
Yes.
That's what is said in the packet. But and we had done, prior to your coming here, across the board 5% decrease, which I think also impacted the hospitals, if I remember correctly. So we're really kind of just bringing them up, plus a little bit considering the amount of time involved. So it sounds reasonable to me. The only question I have is, I know that we've been doing, as a result of the COVID impact, individual adjustments for various providers. I don't know if that's included the hospitals. If it had, it did not.
No.
Okay, so this would essentially bring them back to where they were with about a 2% increase. And that seems pretty reasonable to me. Thank you.
Thank you, Nick. Selena, did you have a question or a comment?
Yes, I'm not going to be voting on this since I do have a direct, it does have a direct impact on my hospital system. I think that on behalf of this, I think it's the right move. Macomb County has, we have been reimbursed from 2015 rates for quite a long time and have been very faithful to Macomb County. During COVID, we did get hit on the inpatient units because we had to decrease our admissions since they are community settings and we couldn't have 2 people in a room. So I think that on behalf of all the hospitals that are contracting with Macomb County, I think that this is a great thing. And I'm sure that everybody's going to be greatly appreciative to it.
Thank you, Selena. Any other questions or comments from board members? All right, seeing and hearing none, all in favor signify by saying aye.
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 All opposed? And Selena abstains. Motion passes. Next is item 5B, request to approve the mobile health clinic. I'll take a motion to approve that to full board.
So
Move to approve, Bush.
Got a motion from Nick and support from Linda. Dave, go ahead.
Again, we were the recipient of some of the CARES Act dollars that went to Macomb County. they allocated, made some of those available to us under very strict conditions. So we were looking at ways of maximizing that. We made several suggestions and recommendations that were denied given the rules that apply to the county's funds under the CARES Act. This one was approved. So it has been approved by the Office of the County Executive for us to expend these funds in this manner. So it won't hit our the PIHP or CMHSP budgets. The intent of this is to allow us to increase our community access. Transportation is one of the biggest barriers to services. This fits nicely hand in hand with our CCBHC efforts to increase community outreach. I did make it a statement in there about working with other departments within Macomb County, and other departments were involved in the review of this. So we did speak with the Macomb Community Action, and we're following up as well about some interesting ideas about fleet services and sharing resources between the various county departments. I gave you the proposal that I had submitted to the Office of the County Executive. Again, we would use existing staff resources. These funds would be for the vehicle, for a logo, which according to county fleet management is minimal, along with some of the technology that would allow us to provide those services in the community. They do make specific vehicles that are mobile health units. TJ from our side is very well versed, and he's taking point in working on our side and working with purchasing and fleet management on the county side to get the appropriate vehicle that will allow us to do the outreach that is very much needed. And I'll make some more comments during my presentation about our outreach efforts.
Thanks, Dave. Any board members with questions or comments?
I have, Phil.
Go ahead, Chris. I think that's Chris. Or is that Ryan?
Ryan.
Ryan, go ahead.
Hey, Dave, could you please have TJ or you present a update once if this passes and if it goes through?
Sure.
Thank you.
We're currently looking at, like I said, a specific vehicle. They're short supply, and it might be that it's from out of state. The requirements of the funds are that we have to expend them by the end of the calendar year. So we're in a bit of a crunch to get the vehicle in place. But with your approval, we'll continue to move forward, and I will keep you updated.
Thank you.
Thanks, Ryan. Any other board members with questions or comments?
Well, I just want to thank Dave for bringing this innovative opportunity to go where the people are. Thanks for thinking out of the box and thinking of how to spend that money, Dave.
Thank you.
Thanks, Linda. Anyone else? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. Next is item 5C, Learning Management System RFP. I'll take a motion to approve to full board.
Motion to approve.
Oh, sorry.
I heard, I think, Burke and Bossberg? Sure. Dave, go ahead.
Well, we've met with I reached out to the Macomb Provider Alliance earlier, probably around April when the pandemic hit. And actually remote learning was #1 on their wish list, which surprised me. We've met with providers numerous times, again, going back to the provider stability plan. I've encouraged the providers to think outside the box, to submit requests to us about costs that they've incurred that are outside of the current federal programs that are in place to help providers, outside of the rate structures and changes we currently have in place. And like I said, their number one was remote learning. Earlier too, we used to get a lot of our direct care worker training through MORC, and then they notified us they were stopping. It's at that point that I began to realize how the scope of the training requirements within our system and the associated cost and the administrative oversight. So at this point, I am very happy to pass this over to Lauren, who can speak to it in more detail. But just kudos to Lauren. He did a lot of the legwork. He reached out to numerous learning management systems, set up remote interviews and demos of their products, and really was our point person on this. So big thanks to Lauren. And Lauren, please unmute yourself and speak freely.
Hello, everyone. In regards to this item, we're looking at trying to bring Macomb County's ability to provide adequate and quality training to the staff members and the service providers and meet everybody at a point that we're currently in. As you're aware, once COVID hit, we had to discontinue a lot of in-person trainings, and we were left scrambling at times to try to get some things up together, which was where a lot of the state was. Dave and I have had conversations about the direct support professionals within the residential group homes needing training, the scope and magnitude of that staffing issue, the high turnover rates at times. And one of Dave's visions that I share is moving towards an online training platform that will deliver and meet adult learning principles, while also allowing staff to complete trainings, not in a 2-week live in-person format, but in between downtime at the group homes, in between shifts, to tie together more of a out of environment and in environment learning experience. So they can take things that they learned in the training modules and apply them into their services that they're delivering within the home in a more real-time manner. We're looking at a couple different vendors. A number of them will provide us the ability to provide synchronous training opportunities, where staff will be able to virtually participate in trainings, which will do a couple things. One, it will cut down unintended training costs, such as the commute time, the travel reimbursements, lost time of productivity in that commute. The other thing that it will do is maybe help staff find a little better balance. There are staff that would have to come to the office for a 2-hour training from their home, and not everybody lives in Macomb County. So I think that would help staff find a little better balance in their lifestyle. A number of the programs also have e-learning authoring tools that'll help us create a more interactive training experience for staff to help them retain some of the information as well.
Bill?
Hold on, Nick. Megan and then Nick.
Megan, you're muted.
I was having a full-blown conversation. Sorry. Lauren and Dave, I definitely commend you for this. I actually just went through this in my previous employer and just walked into a new learning management system at my new employer. So I totally know what a tough time it is to go through that. So I definitely commend you guys for that. Lauren, I like that. So it sounds like, does this LMS allow you, it doesn't just also provide content, but you guys can create content as well. So it can be content on anything. You could do, harassment trainings. You guys can upload your compliance training, things like that. Like you have the ability to either create or download their content.
We can definitely create. A number of them do have authoring tools included. Some don't.
Okay.
but also we would be able to import trainings if we were to purchase ones that are specialty. It'll also allow us to maybe collaborate better with our partners in the Tri-County area.
Sure, I love that. Okay, definitely, that sounds wonderful. So you guys did great on that. I know there's a lot, so good job.
Thank you.
Thanks, Megan. Nick, go ahead.
Yeah, Lauren, will this then essentially standardize training for direct care workers? I sat on a legislative boilerplate committee several years back that looked into the problems of retaining direct care staff. And we found that one of the expenses that we were trying to find a way to get rid of, we were talking about certification at that time, was that I worked for provider A and they had to train me, and then I go over to provider B and they had to train me, which just repeated with the training I got at A, with so forth and so on. We've got a lot of direct care workers who work for multiple providers. So if we can kind of standardize this, and I think that's what you're doing, is that part of what this will accomplish?
So there is a work group that is working towards training reciprocity for the direct support professionals, where we're creating and updating guidelines that were in existence and fell out of practice. I'm sorry, 1 second.
Lauren, you got to put him on camera now. We got to see him.
Right, right.
We do take.
This will be on YouTube, Lauren.
Would so share the dog with you guys. Unfortunately, my son just got back from his first soccer game. My 4-year-old's also going to be entering in to the room, so it is going to get loud. So it's probably going to continue this down in the basement, just knowing my family dynamics. But that is one of the goals, is reciprocity along those lines. And that is something that the entire state is working towards.
So this won't accomplish that, but it will facilitate that.
It will definitely facilitate that. And I think it will also allow us to collaborate more with partners, once again, within the state.
Right.
Taking some initiatives to have even an MCCMH training YouTube channel for staff to be able to see demonstrations on how to administer medications, for instance, various other techniques. But also it will allow them, if they're not typically doing that, to observe the appropriate steps to keep everybody safe and ensure that medication is administered correctly. So they can kind of go with each step to ensure safety.
Thank you.
Yes, sir. Thank you.
Thank you. Any other board members with questions or comments? All right. Seeing and hearing none. All in favor signify by saying aye.
Aye. Aye.
All opposed? Motion passes. Next up is item 5D, request to approve of FIA Inc. I'll take a motion to approve that for full board.
Motion to approve.
I think I heard Nick and Lori.
No, I didn't, but.
Well, I got one of them.
It was Fantuzzi, and I don't know who the other one was.
Thank you. All right, Fantuzzi and Phillips. Dave, go ahead.
This one I'm going to pass over to Adam.
Yep. Hey, everyone. So this is the upcoming FIA contract that we have before you. So a couple things that are covered on here. We've got continued report creation and migration of the old Crystal reports. We have maintenance of the data warehouse. We have creation and consultation of the CCBHC dashboards. AFIA has one staff who has experience with workflows in CCBHC, so we're going to use some of her knowledge to review what we have and help us move forward on that, as well as the data gathering for CCBHC. And I know Dave's talked about it before, and it enforced the importance of gathering this data in order to continue the program. We are also adding the MACOSA dashboards under here as well. When we were working with AFIA, we looked at the different, almost like the different lines of business we had, and it made sense to put everything under one contract. So if you remember back a few months ago, I think you actually approved AFIA to work with under the CCBHC, but to make it streamlined, we just added it under here. So that's going to be part of it. A couple goals we have for the upcoming year, just to keep you aware of, is we have 2 staff that are trained in creating dashboards with the AFIA system. We have the ability to have 1 more staff trained so they can create dashboards. So overall, it's been a goal in the past, and we're continuing to push this forward. We want to bring the creation of these dashboards in-house. We want to have staff be able to do it. So eventually we're able to move AFIA just to managing the data warehouse. So that's a big thing that I'm pushing moving forward. And, you know, I want to say a real quick word about the partnership that we've had with AFIA. We have a weekly meeting with them, and not just with AFIA, but with one of their co-founders and managing partners, Chris over there. So he takes an hour out of his time every week to meet with us and assist in really moving these dashboards forward. He also helped us to create at no cost to Macomb the phone dashboards that we have right now. If you remember back during the summer, I presented some information to you on our phone data. And then right around the same time, Chris had made an offer because of COVID. He said, hey, we want to help our partners free of charge. Let us know a project that you'd like to work on, and we can help you with this. So we brought up to him the idea of taking the data that we have through our new phone vendor and putting it into a dashboard so we can see it real time. And they took that on and they created it, and it is a dashboard that is in use right now. And just one very practical thing we do with that is we're able to see when the call volume is increasing and then determine what we need to do staffing wise to assure that we're meeting the needs of the people who are coming into the call center. Just a real quick thing about some of the other reports that and dashboards that we've put together and are in use. The phone, as I mentioned, we have a lot of hospital dashboards that our access center uses, including length of stay, hospital recidivism, and hospital cleaning. Getting an echo there. So those are ones that they use now to help make their decisions. Oh, and also one last thing, we received from MDHHS a mental health block grant for technology-based recovery support, and within that block grant, we identified that we want to use some of that money towards AFIA, and we were actually approved to use $100,000 of that block grant directly for AFIA. So that's going to wipe away about half the cost of what's in the contract. So that's about it. We're really excited to continue to work with them and move this forward and have some really good results for us.
Thanks, Adam. Nick, you had a question?
We've approved AFIA's contract before. Is it up? Is this a renewal of the contract?
Correct, Nick. It's a renewal.
Oh, okay.
Goes by fast.
Seems like we just did it. That's why.
Right.
And one other question while I've got you, Adam. AFIA was going to give us, or you were going to give us from AFIA usage data that they've compiled periodically. I remember one report on that. When will we likely see our next report?
So the usage data, Nick, can you just clarify which type of usage? Are we talking about phone or just how much we use?
Yeah, all the different things that we're keeping track of.
Okay.
For instance, the crisis line, the hospital usage, et cetera, et cetera. It was a pretty comprehensive report. It was a good report. I just don't know when we were likely to see the next one.
Yeah, so specifically for the phone data, that report is ready to go, and I can share that at any time. If you'd like, I can share that at the full board meeting. We can go through some of the phone detail. For the overall usage of the other dashboards, I can get that from AFIA. One thing they keep track of is, well, not they keep track of, but we have available to us is when staff log on and how frequently they use it. So we can look at that. The other information I just gathered from the staff. For example, some of the hospital dashboards, I asked one of the access staff, which ones they use and how frequently they use it. So that's where I got those ones from. But we can definitely pull together a real comprehensive report about, other than the phone, which ones they currently use and how frequently they access it.
Okay, thank you.
Yep.
Bill?
Dave, go ahead.
Nick, just if you recall too, we have a schedule of reports for the department, and Adam is on there. And in his routine reports to the board, we'll be including some of those.
Oh, okay. Yeah, I'm just trying to figure out the schedule. Thank you.
Yep.
Thanks, Nick. Any other board members with questions or comments? Not seeing or hearing any. So we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. Next up is item 5E, request to approve MDHHS employee contract. I'll take a motion to approve that to full board.
Motion to approve.
Motion from,
Phillips and O'Connell.
yeah, I got it. Dave, is that you?
Yeah, I can't pass this one off to anybody.
All right, I thought so.
Yeah, so we have this contract in place, and we have Danielle working with us, who's just a huge asset to our staff and to the people we serve. We get expedited processing of the Medicaid applications. We get, when I have questions, I can go right to her. Used to be able to walk right to her. Now I have to email her and things like that. But it's been a long-term relationship. It's working very well with very positive results. When we look at people who enter our system without insurance, really the time frames, our percentage of folks that get turned over to Medicaid and it goes retro is actually very high. So I do recommend this contract and happy to answer any questions.
I have a question.
Go ahead, Tony.
There's a section in there that allows for some traveling. What sort of traveling will be done by Danielle?
Hardly any now. That was in place before. She was on site in our office, but she is an employee of the state of Michigan. And if she had trainings and things or reasons to be back at the various state offices, then she'd have to travel back and forth.
Well, just wanted to make sure she didn't live in Lansing or something like that.
No, she was on site in our offices before the pandemic.
Thank you. That answers my question.
Yep.
Thanks, Tony. And I can tell you from Macomb County, it's about 200 miles round trip to get to Lansing. So just a heads up. Any other board members with questions or comments on this item? I don't see any. I don't hear any. Lori?
I would like to make a comment because Danielle has been a lifesaver as a parent to me. I can't even tell you how many people she has that I know of she has personally helped over the years regarding Medicaid, Medicare, where we could bypass sitting on Mound Road in the Michigan Department of Health and Human Service office for 4 or 5 hours. So I think Danielle has been such an asset to working with CMH, and I just appreciate everything she's done and for everybody I know as well as myself.
Thank you, Lori.
Thanks, Lori. All right, anyone else? Questions, comments from the board? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next up is item 5F. I'm guessing that's the character club, which is the most unique way to spell character I've ever seen, which is cool. And I'm guessing this is a Cyndia item.
Yeah.
Go ahead, Cyndia.
The Character Club is a really great opportunity for us to have full-on graphic design services and support for all the work that we're getting. Things have certainly ramped up, and it's very complimentary for us as we continue to develop our outreach initiatives and kind of push things forward on that side with the new CCBHC grant. This funding this support service will be funded in part by the CCBHC grant and also my department of funding as well. And outside of that, it's a really great service. I did do a small like trial contract with them where it was just for a week. It was complimentary on them for them to allow us to assess their services. They're really, really a great service. They provide a project manager along with a full-on design team at our disposal. They offer a lot of really great services, and as we continue to develop and expand our outreach, they will come in handy very, very much. So I'm really looking forward to working with them, and I believe this is definitely the direction that we need to be going in.
Thank you, Cynthia. Any questions or comments? Dave, did you have anything to add? Nope. Okay. All right, hearing and seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Thank you, Cynthia.
Thank you.
All right, next is item 5G, request to approve to issue a request for proposals for substance use disorder outpatient ambulatory treatment. I'll take a motion to approve that to full board.
So moved, O'Connell.
Everybody now, all together. Is this a Helen item or is this a Dave item?
It's Helen.
Go ahead, Helen.
All right, thank you. Yes, at our Oversight Policy Board on October 2nd, they made the approval to submit this request to the board here. We're looking to see adding some additional providers to our outpatient service array. Over the last year, we have lost 2 of our outpatient clinics. They were smaller clinics, but still we like to have as much availability as possible to serve individuals. We look to ensure that we have timely access to care, and our providers are able to meet our key performance indicators as set forth in the state, but we really try to surpass those numbers in that if we have somebody moving from a higher level of care, such as a residential, down to outpatient care as part of their aftercare service, we like them to be able to get into that service as quickly as possible. We've also received some requests over the more recent months from some of our providers to add some additional services, which could help in us meeting some of the different ASAM, the American Society of Addiction Medicine placement criteria, levels of care, such as partial hospitalization or more intensive outpatient treatment services. So we just request that we're able to issue this proposal and see what type of services might be out there that we could purchase.
Thank you, Helen. Do we have questions from board members? Questions or comments? All right, I don't hear any. I don't see any. All right, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. Thank you, Helen.
Thank you.
All right, next up is the hot ticket item. 5H, recommendation for mental health authority. I don't know if anybody wants to make a motion, if we want to have discussion first.
Well, I'd like to have a discussion.
Yeah, so would I.
I would propose that I'd like to make a motion that we table this and get into a closed door meeting and consider all of the input that we've gotten from today's meeting before we make.
Tony, I don't think we can legally do that in a closed door meeting, but I would support a motion.
Please, I didn't want the motion supported because then we can't discuss it.
And I was going to say that we cannot go into a closed door to talk about this.
Right.
Okay, then I would withdraw that request.
Thank you.
Wait, we can withdraw. If you don't want to have a discussion, I'll withdraw my second. I don't have a problem with having a discussion. I do have serious concerns about taking any action on this item tonight for several reasons, but I'll defer to Tony and then look to be recognized when the chair thinks is appropriate.
Thank you, Nick. I was trying to call on Chairwoman Vosberg. We'll let her speak.
Mm-hmm.
Thank you. I raised my hand. I don't know if you saw that.
I was trying to call you too, but everybody was talking at the same time.
No problem. That's fine. It's one of the things that we've been doing, the work group has been studying this for a year, maybe, or more. And one of the things, it's kind of slow because as we know, it's hard to get a lot of data. We finally got a report regarding actuarial studies. 2 actuarial studies were ordered. One of them is complete, and that is the pension portion of it. But we just got that information, so it's not in a big, a nice fancy packet that everyone can look at. And the other one we're expecting to be back in about 2 weeks, and that's on the retiree health care. So in my opinion, one of the reasons I wanted to see this come out of the work group and forward to this board and the Board of Commissioners is that we've been looking at various portions of this for well over a year. I wanted it to become a very transparent process. So by coming to this board, it's now being discussed in a public meeting. We had heard a lot of comments from people, and they're all very good comments, very justifiable comments. And actually some of them, I wrote everybody's comment down because those are all answers that we too as a board want to have before we as members of that work group wanted to have before any board would approve this, including the Board of Commissioners is where it ultimately goes. We could totally not do anything about it. The Board of Commissioners could still take this on because that's how the state statute is written. It's under the purview of under the decision discretion of the Board of Commissioners. So I too do not want any surprises. I too want us to have as much, the Board of Commissioners, they're the ones making the decision. So I'm just going to speak about them, that they will know what that looks like. They would know what consequences would be, what outcomes would be, what possible, then whatever possible things answers we need and they need regarding the structure of employment, and all that includes from pay to current pay for current employees to retirees and those considering retiring, those in the drop, all of those things. I think these answers can be had and then shared with everybody all at the same time. And that's one of the big reasons why, even though we didn't have all of the answers, that we did at least get this out so that it can be continued discussion with everybody involved. Because here's the time when people have different interests, different points of view, and also different knowledge bases that those of us on the work group might not even have. So that, again, I'm repeating myself, but I wanted to get this out in the open. That was one of my big things. There were 2 members of the work group who did not approve sending it out. And I understand that because they did not have the answers to give that. But I think we were very respectful of that. We assured them that we don't want to see any decision made without having all the answers either. So I'm glad that we have this. I'm glad to hear the interest of the employees. I think that's very appropriate. And all of these questions need to be answered. They're all good questions to be answered. So, and I think I'd like Dave could, or Phil, if you want to address anything on behalf of the Board of Commissioners, or Dave, even if you could just review basically an overview of the members. We don't need all the names, but who they represented, if you have that.
Yeah. Our task force had representation from people served, family members, our provider system, the Board of Commissioners, the CMH board, the MCCMH staff, leadership, and
the county exec.
Yes, in the office of the county exec. So I was making notes earlier. Yes. So
The unions. Did you say unions?
Those were employees.
Employees, but yeah, they happened to be,
right.
It was Jenny and Donna.
Right.
And myself. And then we had various, subject matter experts with lived experience who had gone through this process that were able to share and respond to questions from the group. So, I mean, it was a very thorough process. And our last meeting was a review of the actuarial studies of the retiree pension.
Phil, if I could ask a quick general question. I've got a ton of questions, but I'll wait.
Yeah, go ahead, Nick.
But my general question is, do we have a report from the task force or simply a yes/no recommendation? Because, and the reason I asked that question, I attended the first couple of task force meetings, and I was asked not to, by our chair, not to bring up my questions to the task force because it would just be a duplication. We would be doing it a year again. But I think the task force might have been able to find some of these answers, and maybe they have. But my understanding, what I've been told, is that the task force met at 8 o'clock yesterday morning, I think it was, or the day, yesterday morning, and reported a recommendation to move to authority status, and that was then immediately placed on this agenda. And I'm happy to hear Kathy say it wasn't for action, but for discussion. His discussion is certainly warranted on something this big. But the problem, I guess, one of the concerns I have is I've got a list of questions, and it's a growing list, and it would be a lot longer. But for the fact that I just found out we were going to discuss this today, and I don't mind doing it at different times, but it does concern me that the task force, if it has found answers to various questions, hasn't given us a report to look at, as opposed to simply a recommendation to do it without any justification or pluses and minuses or anything of that nature. I was the person who moved to create the task force, as you'll recall, and my anticipation was that the task force, I've been through the process of creating authorities before, both inside Macomb County and out. We did it with Macomb, with the Martha T. Berry home a few years back, but we were able to discuss not only the actuarial issues of retirement, but with the retirement board, right? Because the retirement board is not the Board of Commissioners, not us. The retirement board has the final say as to whether or not we'd have to create a new retirement system or that they would be allowed to continue within the retirement system of the county as authority employees. With the authority we created for Martha T. Berry, the retirement board made the decision that they could stay in, and they opted to stay in, and that saved a lot of problems for a lot of people. I don't know if anybody's consulted the retirement board. I mean, like I said, I have a whole list of questions that I'd be happy to put forward now, but if we had some sort of a report from the task force, I'd know which issues they've addressed and which they didn't. Some of the labor folks that I talked with on the task force were very disturbed that they had raised questions from the first meeting forward. I know I raised some questions at that first meeting, including what we would be charged by the county for the various services that we use now, or will we be going outside for independence and so forth and so on. And I haven't heard anything and I know that question was raised at the first meeting, so I don't know what the task force actually found, what data they found. That Kathy indicated there's some actuarial studies And I'd certainly like to see them, but I'd also like to see what the task force found in terms of the various questions that were raised by task force members, some to the county personnel director, some to the county HR office, and others in terms of what's going on. And I didn't get a chance between yesterday afternoon and tonight to recheck the statute. The statute provides for some temporary protections for the employees, but my questions revolve around a lot of cost items that not only involve the employees, but involve a lot of other things. And I've been sitting on these questions for a year and a half, as Kathy indicated, because I was asked not to bring them to the task force, but to raise them here. And I'm going to raise them here at whatever the appropriate time is.
Thanks, Nick. You mentioned Kathy's name a couple times, so I'm going to let her speak.
There wasn't I didn't mean that as an insult. I think I understood what her rationale was.
Right. And if, Nick, we want to hear all those questions. We need them all. I don't think the motion was to recommend going to an authority. The motion was recommend bring the authority discussion to the concept of forming an authority to the CMH board and the Board of Commissioners. I don't, because even our comments after the motion was made was, we don't have all the answers. We need to have the answers, but we needed to get it out of the work group. The work group could not do any more work. Now, and you're absolutely right. We have minutes from all the meetings, and we will be able to share all of that. And the actuarial information, actually, we did not see, a written report. I'm sure there is a written report, but it was delivered so recently that we didn't have it. We can get all of that, and we need to have all that.
I appreciate that.
We need to make informed decisions. So all of those questions you have, please record them, and we will continue getting that information.
Okay, yeah, and that's fine. I mean, I appreciate that, and I think a lot of the distress that our employees were concerned about was that it looked like that this was going to be that we were going to take action tonight, send it to the full board, send the full board to the county, and that the county commission was going to basically move very quickly. They have to have 3 public hearings, so it will take some time. There was a rumor going around, David, and I don't believe rumors, and I know you wouldn't have said it, but there was a rumor that you said, well, they can have their 3 public hearings at 1 o'clock, 2 o'clock, and 3 o'clock on the same day. I said, well, I don't believe David said that. But,
you repeated the rumor.
The question was raised, is there a time?
It's a serious problem.
Well, health code has no set times between the meetings. So they could happen back to back. There was never any intent for that to happen.
Yeah, I would be
followed up by saying they probably were 30 days apart at a minimum. Yeah, about.
Well, you have to give 30 days notice for I believe. I have to review the statute. I haven't reviewed it in a long time now.
You do it for the first meeting.
You have to give 30 days for the first meeting at least. And then you don't have to do 30 days between each one, I agree. But, you doing 1 hour apart would obviously be ridiculous. But
it's meant to be a deliberative process. And, it's stated by, you have to have these public hearings. All of it's meant to be deliberative. It took us over a year to get the information that we have, and that wasn't through a formal process. That was just, informally having a work study and calling people and getting information. Some of the best reports that we got were from others who have gone through this. And from my perspective, some of the best ones were that employees were pretty much held harmless in that they were able to keep the same employment conditions, salaries, different things like that they had before. And the most successful transitions were the ones that kept things the way they were. And just regarding employee assurance, we're kind of in a world now that things are changing all of the time. But for me, keeping this in a work group just was enough. We'd had enough. This way now employees can be part of the discussion openly. They can hear what's being discussed. They've already heard other people ask questions. They're probably thinking, oh, I didn't think of that. And some of us are probably going, oh yes, we need to address that with more detail, all those things. So I'm looking forward to everybody being part of the discussion. And someone asked, what are the benefits of that? And that's something else that we need to, be real clear. There's no reason to go into this, do all this work if there's no benefit. So,
correct. I think we're in agreement, Kathy. I'm just going to ask the advice of you and the chair. If you want me to list some of my questions now, what I could do is just put them and write them and distribute them to the board for another time when we have a more opportunity to have a fuller discussion. That's fine too.
Yeah, I think that would be great because then the rest of the board members can see them and help to, that helps us thinking ahead of time of the discussion when we have some of those things. So thank you.
Yeah, I'll be happy to do that.
Yep. Okay. Thanks, Phil.
Both. I've got Linda on the list next.
I was a member of the task force, and I just want to share this. Of course, right off the bat, the task force and even the employees tonight, our first concern was the impact on people who were served. And person after person who came before us said there really wasn't any impact to the system, to the that would be felt by the people that we were served. So then every meeting after that, the concerns of the employees was what we talked about. I felt very sad tonight to hear that employees didn't know that for whatever reason. There are a couple of reasons, but every single meeting of the task force, that was something that we were very concerned about, and part of our due diligence and part of how we wanted it to turn out, that the impact would be minimal to the employees because of the work that they do, the jobs that they do, and how we hold them in esteem. So I was a little disturbed tonight that they didn't know that.
Thanks, Linda. Next up is Megan.
I just, Linda, I agree with that. Nick, I agree with what you said. Tony, Kathy, I just want to echo that. And I want to be honest. So I think I'm the first one to speak from a perspective of not being on the task force and not being affiliated with the task force, and being a board member who's going to be talking about this and looking into all this. We have a lot of unique perspectives on the board. We have somebody from the Board of Commissioners. We have doctors, we have attorneys, we have people who've been in the business of mental health. We have parents of people who utilize the services. So I think that the rest of us also have some input and some questions. So I actually appreciate that it's coming to the board to be talked about, because I haven't been really a part of that. I know that we've had updates given here and there throughout the process of the task force. But I definitely, as a board member, really do support and appreciate the fact that it's coming to us. And I appreciate the forum tonight. I really appreciate everybody coming out and giving your perspective, because I think that that's super important. And now I think we need to sit with that and ask those questions and get that out there. So that's why I am in support of bringing it to this next step. So thank you.
Thank you, Megan. Were there any other board members that had comments? Questions? I know going forward, if you have questions, if you have thoughts, please compile them, write them down. We will continue this process in a public forum, obviously, so that everybody can hear the questions and the answers going forward. Dave, did you have any comments to make?
I guess I'd like to echo Linda's comments too, and mention on the communication front. Communication has been one of my top three since I started. We've been doing regular staff meetings. We actually have another round of them scheduled starting, I think, next week. We're doing them virtually, but kind of setting by setting. And I've set out, I shared the email that I shared with staff. It includes my cell phone number. Everybody has my email. I've already responded to 2 staff who had email questions about how, what it meant. And again, what Linda said, you know, when we organized the task force, we looked at parties who would be impacted by a mental health authority. That's why we had people served. We had providers on there. It became real obvious in the first meeting or two that really the impact on the community at large would be negligible. They wouldn't notice any changes at all. The impacted group was the staff, and they've been our focus from day one. They've been the center of our communication efforts. You know, it's been a fairly transparent process. So when the task force decided, by the end of that very day, I told staff, you know, it's coming up again. The fact that they're here and interested is a good sign. The staff meetings are already scheduled, and I have an open virtual door for all the staff at any time. We are collecting the responses, and we'll be doing frequently asked questions. We won't include, you know, the name of the staff who asked the question, but we'll include the question along with our answer. It's difficult for me because I want more than anything to, you know, give staff specifics to their specific situation. And that's information that's simply not available right now in a lot of these areas. The information that I did share was extremely detailed given the situation that we're in. And I did that to try to allay their fears and let them know that there is precedent, as Nick mentioned, as I mentioned in my email to staff, that you just stay in detention. There's no change whatsoever. That is up to the retirement board, and the county is following up with the retirement board to clarify the options with that. Healthcare was discussed. Current employees in the defined contribution plan were mentioned. And, you know, we've detailed out all that information. As more detail becomes available, that will be shared as well. And it will be, you know, I'm wide open to public meetings, the staff meetings. Staff can ask anything they want. If I can't answer it at that moment, we'll note it and distribute it as part of a frequently asked questions. But staff need to know that they were and continue to be the priority concern during this whole process. And, you know, we want to minimize any impact on them as best we can. The community needs right now are increasing. I had a staff person, she was mentioned like a concern about her jobs. And I'm like, the community needs are increasing right now. We're on a upswing, on a growth pattern. The needs in the community mental health, and based on like a conversation with Macomb Community College, with the East Point Police Department, they're hungry for additional help and support. Yeah, so I just see, you know, increased need for staff, for the great staff that we have here. So we'll continue to communicate and share information and details as it becomes available.
Thanks, Dave. And I just want to mention too, as being both board member here and a member of the Board of Commissioners, that this originally came about for 2 reasons. One was because of the budget/financial issues we at CMH were having here. And the other was because there was discussion of the executive's office not signing the PIHP contract. So that was the beginning of all of this, and that seems like forever ago, but it was about a year ago at this point. So I just wanted to point that out real quick. And based on how the discussion is going and will continue to go, at this point, I want to make a motion or get a motion to just receive and file this conversation, and we can move forward. We can continue to ask the questions, get the answers, and proceed from there.
Phil, I'd be happy to make that motion, but I just want to make a couple of quick comments. The exec's problem was with our finance department, and thanks to Dave, we've handled that a lot better. So I've always said that I didn't think the authority would make a dramatic difference. I've seen them work and I've seen them fail, and they all worked or failed based on employee issues in terms of service to the consumers. You can do it through either route. You can make either route work, I believe. What concerns me, and Dave, I know you make a great effort at communicating. I've got more communications from you than I think the last two executive directors combined in your relatively short tenure, and they were pretty open with me, but you do a great job of communicating. I would just make one suggestion, that it would be wise if you sat down with the leadership of Local 411. The new president is brand new. She just took over August 10th, so she's not as familiar with all this as Donna is, and Donna's now retired, and she's not CMH, but there's an impact that if we went to authority status, because the number of CMH employees are as large as they are, as a proportion of total county employment, it will have an impact on them as well. So I think it's important that you sit down with my successor, Tim, and with Donna's successor, Cindy, and have a frank and honest conversation with them. And I know you'll be frank and honest if you have a conversation, because you always have been with me. So to that end, Phil, I think a motion to receive and file is in order, and I'll make it. I'd just like to suggest we also think about how we want to have a full board discussion on this issue and raise all of the questions after we've gathered them, because it could take up way too much of a regular meeting. We may need to have a special meeting, Kathy, at some point, just for discussion purposes of this, to bring folks in. That's just a thought, but I'll move to receive and file.
I'll support your motion.
Thanks, Nick and Kathy. Are there any other comments or questions right now at this time from board members? All right, think about the questions that you have, jot them down, pull them all together, and we will continue this discussion. We do have a motion and support to receive and file the conversation, the discussion. All in favor signify by saying aye.
Aye.
Aye. Aye.
All opposed? All right, receive and file is passed. Next is item 6, which is receive and file. We just did that. Item number 7, resolutions. We don't have any at this time, which takes us to item 8A, Chief Clinical Officer presentation from Agnes Ward. I know she's here. She's been hanging with us this whole time. Dave, did you want an intro or just hand it over to Agnes?
Agnes has graciously offered to postpone her presentation. It's at the board's choice right now. She is very prepared to give the overview of her department. So I'll leave it up to the chair.
I defer to my board members.
Supported either way.
I would support deferring so that we can go to hearing of the public so they can have their final say for the evening.
I would agree with that. Yeah, I'd agree with that.
I agree.
I agree as well.
All right.
I also agree.
It's also 8, yeah, it's 8 o'clock as well.
2 hours. You get 2
All
hours.
right.
2 hours.
That is just fine.
Thank you, Agnes, for hanging with us. We will probably see you in 2 weeks.
Yeah.
For the record, she was very well prepared to present this evening.
All right. Thanks, Agnes. We will move on to the CEO report from Dave.
Thank you.
You're not getting off the hook.
Yeah, I wanted to hit on some points. You gave me permission at the last meeting to sign the 2021 CMHSP and PIHP contracts. Still going back and forth a bit on our CMHSP contract. Again, the state is using the eGrams website in order to process those. I was able, after a lot of back and forth, to pull down a copy of that. It was reviewed and approved by Aaron. It's still stamped draft across it. But since it was approved, I went in earlier today to try to sign it and received numerous error messages. So that one is still in process. Sorry, one sec. The PIHP contract, I have noticed from the department that it's pending and should be out very soon. That's the one we've been actively involved with both of them on the negotiation process. Aaron was on the final walkthrough negotiation, so his review should be pretty short once we do get that. So both of those are still pending. I touched on a bit of our community outreach efforts. I wanted to thank Linda for connecting me to the library system. And I'm kicking myself for not thinking about the library system before that. They are very active in the communities. They are doing a lot of virtual informational items for the community. They are seeing the need for increased information on mental health, anxiety, depression. So I reached out to our team, got a bunch of ideas for topics, shared that with them, and we're setting up a series of trainings that will be virtual. They will be recorded and then available to the general public. So thank you, Linda, for that. I also had a meeting.
Connection. Oh, here's me.
You broke up a little bit, Linda.
We're very excited for the connection. It's a good partnership.
Yeah, I've already heard from Harrison Township and Fraser, and they're bumping me up to director of the Suburban Collaborative, which is a couple of sites in Oakland County. So yeah, that's going very well. I met with Macomb Community College. Her question was, what number can I give them tomorrow? Because they too are seeing increased need among their students. And you know, everybody seems to know somebody right now who is struggling. So the timing of our CCBHC grant, I think, could not be better. We're seeing the increases, and I think they're going to start to accelerate going into the holiday season and everything else. We have upcoming meetings. Oh, the East Point Police Department today, again, was great. I need to follow up with my staff because I offered the ride-along abilities with they have officers that are trained in the critical incident trainings. And they are dispatched whenever there's a mental health component to the call. So we might be able to set that up, but we are getting information out to them and working to connect them to our mobile crisis teams so that, again, if they're dealing with somebody and there's mental health issues involved, we can be much more connected. Have similar meetings in process with the Sheriff's Department, and we'll be reaching out to the other police departments as well. Our CCBHC services began August 31st. So since we met last time, Actually off to a good start. And another big thank you to Agnes. She is the program director for our CCBHC. So she wears numerous hats. It was definitely a team effort. So the Crystal and her team, especially at First North and the open access and everywhere else, have been very involved in helping us establish those workflows so that we can be prepared to meet the demands of the grant, but also the demands from our community. Waiting for that. You also approved the contract with Chris Elias. I'm happy to say we've had leadership trainings, 2 full-day leadership trainings with Chris, and we're off and running now. This will become very much a part of how we operate internally going forward. I will be sharing regular updates with all staff, and the staff will have the opportunities to be involved in that work product from this point forward. This is just going to be part of how we do things internally. I'll be sharing that at the staff meetings, and I'll be giving more detailed written information to the board of directors. So thank you for approving that contract. And lots of other stuff going on, but I will leave my report at that, and then we can go to on in our agenda.
Thanks, Dave. Any board members with questions or comments for Dave? I just want to remind everybody to turn in your August expense sheet, and that the next full board meeting will be on September 23rd at 6 o'clock. One more time for board members. Any questions or comments for Dave? All right. Hearing and seeing none, we will move on to hearing of the public. If you could put your name in the chat, that would be extremely helpful. If not, just shout. We will go to, I believe, where'd she go? I think it was Bridget. Bridget,
Yep, here I am. Yep.
Yes, you have 5 minutes. Go ahead.
Okay, I won't take that long. First of all, Mr. Pankatai, will we have representation for the DD population in this community mental health community collaboration?
We don't respond or answer questions at this time, but somebody from staff will get back to you, okay?
Okay. And I just wanted to, I'm sorry, it's just so dark. I'm trying to move here. What I wanted to say was, in my experience with the other mental health agencies that had win authority or privatized or whatever, there was concern about the poor condition of services, poor quality, and I did witness some fraud, which is unfortunate. I think we can all agree great benefit packages do lure quality staff, and we can keep them. And the concern is the quality for our consumers. I know we talk about, the staff talks about their needs and, the concern about benefits and, including retirement and healthcare and all that. And in order to keep quality staff, we have to make sure the systems are quality, okay? In the past few years, there have been considerable reductions in CLS and respite services, and that's pretty much led to considerable impact on consumers receiving services. And again, that's my concern. When we've already reduced the CLS and respite services. If we reduce the quality of our staff and we overload them with too many cases, which I've experienced at my other jobs, that does end up leading to poor quality of care for the individuals. And when we're talking about information for the staff, we want to make sure that they are given ample information and ample time about the specifics and how the authority will affect them. So thank you for, tabling this for a while. And that's, like I said, that's pretty much, what I wanted to say. And I really love working for VDPS and the quality. I've never seen such good quality. We've had a history of high marks when audited, and I think I attribute that to excellent staff and excellent supervision. And again, quality benefits and income packages do make a big difference. So thank you.
Thank you, Bridget. Anyone else for hearing of the public? I don't see anybody else in the chat box. Give you a couple seconds to unmute yourself. Anyone else for hearing of the public? Third and final call for hearing of the public. All right, seeing and hearing none, we will close the hearing of the public. And with that, we are adjourned. Thank you all and have a wonderful evening.
Thank you all.
Yeah.